Okay, here we go. All right, thank you for joining us today. My name is Paul Cuttajar, as you can see on your screen. I'm the owner of Pivotal Aging Innovations, Inc. And we also have Esther with us, Esther Goldstein. Esther, you there?
I'm here.
There you are, from Senioropolis, Inc. What we'd like to do today is share with you over the next about an hour and a half is an understanding of senior care access, the market it services, the powerful tools it offers, and a little bit about Senioropolis and Pivotal Aging Innovations, all of which is designed to give you an understanding of the power behind this program. I'd also like to mention that the webinar is going to be divided into two parts. This first section is going to identify basically the why and who's involved, as well as why retirement homes have an interest in this and why hospital discharge would have an interest in this program. And then the second half, Esther is going to be actually going into the website itself, and you'll be able to follow along, or you can refer back to this video if you're having some trouble accessing different areas of the website. Not only is the vacancy program going to be identified in the website itself, but we're also going to show you how the database, the retirement home and senior housing database, is accessible, as well as the consulting program, as well as the senior service providers directory that's on the site as well. So with that, I'd like to start with identifying our why seniorcareaccess.com was developed. And the ultimate why is to be able to offer empowerment to older adults managing a life transition. Now, the goal is to bridge three key elements in offering an answer to the questions: what is available and how do they access it? So by having two unique organizations such as Pivotal Aging Innovations and Senioropolis come together on this project, we were able to identify and unify the three elements of professionals, families, and services or programs. So professionally, what we're referring to are social workers, occupational therapists, researchers, discharge staff, healthcare service workers, placement consultants, public sector workers, retirement and long-term care members, that type of employee on the professional side. On the family side, are considered as those in need of assistance or the need of navigation, consulting, housing option placement, future planning, or some form of life transition. Okay? And then on the services side or the program side, may be considered as available options offering a benefit to the user. Now, these may be individual or corporate senior service providers, programs, or other opportunities that may offer assistance or guidance. Now, all of this is made available by seniorcareaccess.com. However, it is backed by a national Canadian database of senior housing solutions and unique professional education relating to seniors. It has been our experience that although there are many individual offerings of services and solutions, the seniors industry remains fractured and extremely challenging for families to discover and navigate. So as we work through our presentation, you will begin to discover how seniorcareaccess.com is designed to answer these areas of concern by offering connectivity to all those navigating the many options. There will always be a tremendous amount of work to do, and the challenges may be great. However, it is our wish that with your support, suggestions, and involvement, seniorcareaccess.com will be able to expand and offer empowerment for all of those involved, in particular our aging parents, but also for ourselves and our children. So the purpose of today's presentation is to introduce you to the Senior Care Access Vacancy Program, where we connect discharge patients with available vacancies from local retirement homes, as well as how you can use seniorcareaccess.com within your toolbox. Get to the next slide here so you don't have to be staring at us anymore. Here we go. So Esther, why don't you do a short introduction of yourself and Senioropolis?
Okay. Most of you know me because I created the book you're all familiar with called The Comprehensive Guide to Retirement Living. We've just released our 22nd edition, which is specifically about retirement homes. The website that the data for the book comes from is senioropoulos.com. As you know, the information we have in that publication and online is very extensive. However, in the last few years, I've been approached repeatedly by people who want to access back-end unbiased data about homes, since the limiting factor for all existing websites has been that the homes that are part of any website pay to be there. This eliminates all the homes that do not pay. So the idea of this second site, seniorcareaccess.com, came to be out of multiple requests and conversations about what we're really good at Senioropoulos, which is data on seniors housing and educating people about it. For years, my focus has been on creating an extensive database of housing information, and Senior Care Access is basically what we have in Senioropoulos on steroids. And parts of the site are specifically geared to professionals who need to access information fast and know the kind of care a person needs. We have a completely unbiased, secure database right now of over 4,000 retirement homes across Canada, and our goal is to expand to multiple levels of care using our over 350 available data fields. In joining forces with Paul and Pivotal, I've been able to add consulting, education, and resource components to the work that I love doing.
Absolutely, that's awesome. So that's the power of Senioropoulos, and as Esther mentioned, some of you or most of you are familiar with the work that she's done, but some of you may not be familiar with Pivotal Aging Innovations, and I'd just like to share a little bit behind some information behind Pivotal. So again, so that you can recognize the power of what SeniorCareAccess.com is trying to deliver. So Pivotal Aging Innovations is owned by myself, Paul Cuttajar, and it engages with several associates who develop and delivers training to professionals on working with seniors within the real estate, mortgage and alternative finance, and estate process. Pivotal also offers a hands-on approach to being person-centered within the retirement and long-term care industries through its proprietary RAFT program, which stands for Wounds, Restraints, Abuse, Falls, and Training. I'm sure you're all familiar with those terms. As well as the consultation service, Pivotal Consultations, for seniors and their families facing a life change or a life transition. Now, the idea of Pivotal Aging Innovations is to bring innovative programs and solutions to the aging population at a pivotal time in their lives. Amongst other proprietary and exclusive licenses, Pivotal and Senioropoulos has created this unique solution as a joint venture. Although Senior Care Access is a new venture, the program has been developed with decades of experience in working with older adults in transition, as with healthcare, hospital discharge, retirement home placement, social work, long-term care, and professional senior services. Now, I'd also like to add that Pivotal carries the Ontario exclusive license for the Ashby Memory Method, which is a cognitive retention therapy program, the accredited and master accredited senior agent program, which is training for realtors working with seniors, the senior mortgage professional training program for mortgage brokers, and the Pivotal Seniors Real Estate Canada referral program, with 2019 seeing Canada's first seniors real estate brokerage. We're still working on that, but we're hoping to have that launched for this year. There are other programs and associations we are working with, but they are in the works and not quite ready to launch yet. But we're always looking for innovative programs and services to bring to market for the seniors industries. So really one of the questions is, how are we different than everybody else? How is our database different from any other database out there? So what we've created is an innovative one-stop shop for all things seniors across Canada. It is a place where professionals, seniors, and families can come to get information and help for older adults trying to navigate the private sector system of care, support, and housing. Now, we are offering an extensive data, search capabilities, and consultative support all under one virtual roof. Although there are others that offer bits and pieces, we believe that there is no other company or organization that offers a model for professionals, public, and service providers within an extensive training and referral reach. The seniorcareaccess.com site itself is a user member-based with multiple features and opportunities for those operating in the senior sector. Regarding housing options, we currently have an extensive database, as Esther mentioned, of over 4,000 retirement homes across Canada, which can be sorted by many fields. Example, location, levels of care, ownership, amenities, language, culture, price range, and the list goes on. It'll see us adding long-term care, 55 plus communities, life lease, senior-friendly condos, and senior apartments to the housing database, which we are continuing to build and add right now. The expanded questionnaire, which we use, will include a host of amenity, meal options, and residence information for all levels of care. We are currently launching the Vacancy Program, which is why you're here with us, for the retirement homes and hospitals. And for those care service providers or individuals who are able to navigate the senior resource system on their own, the site will have a membership component so they can access our database on their own based on the needs of their clients. We're also working with our IT guys on a marketing lead gen program for realtors and other professionals within our network when assisting seniors seeking retirement home solutions. So we're actually working on a program right now where other individual professional users would be able to market the database, gather that information, and then actually be able to bring what we hope to be our qualified leads to the retirement homes. Okay, and that will be a very unique program once we're ready to launch in the next couple of months, actually. So why a membership model? Why not just have everybody be able to access this? So the traditional model of a site like this, where the homes pay to be on it, limits the information displayed to only those who agree to pay and have a budget. So it's rather biased. The membership model of our site allows for us to obtain detailed information from all levels of housing because we don't require those housing providers to pay to be on the site. This offers an unbiased result, delivering substantially greater value to the user, whether it is a family member or a professional. It gives us ultimate freedom in terms of the data we gather and make available to our members. Our members are people who need the information we have and will use it, not browsers who will come to the site and leave a minute later or submit untrue or incomplete lead gen details. And we've all been there, okay? This ensures that those that are with us, both as homes and service provider marketers, will get a more direct and appropriate referral should that referral become available. So the benefits of the membership. Members are professionals, such as yourselves, who work directly with seniors and their families. Membership is flexible and based on how much you need to use our site or how large your organization is. The costs are structured based on the need. Members will have quick and easy access to search for information based on extensive data parameters, as we mentioned, to quickly assist them in meeting clients' needs and making referrals. Members will have considerable time using our platform, will save considerable time using our platform, and will have extensive information to offer their clients. Members may also quickly search service providers within their city and make inquiries and referrals quickly, easily, and at no additional cost. So the resources and service providers that we've been talking about. We have a resource section that is divided by province, city, and category of service. And we'll show you all of this once we get onto the second half of the presentation. Now, this part of the site is free to use by all of the visitors to the website. Therefore, there will be marketing costs for resources to be in this database. There will be a maximum of 4 resources per city, per category, ensuring calls received from our users are more likely to be appropriate and targeted. And we've designed this because of the experience that we have in marketing, in the effort to try to be different from everything else out there. It's important that if you're going to be paying to be a marketer on this site, that you feel that you are, I like to use the word exclusive. You will be one of 4 exclusive providers within that category, and that's not available anywhere else. Each listing will have a color banner ad and a text description of service, as well as a live link to the address of your choice, typically to your website or a landing page or a sign-up form or something like that. The banner will link to the resources website. There are extra options available for those who want to add features or appear in more than one city. Resources will be used by our consultants, the Pivotal consultants, and partners, and will lead to direct referrals for goods and services relating to seniors' needs. If you are a retirement home member or participant or employee or worker that's on this presentation, you will be able to, at no charge, actually access the resource section and offer any of those referrals to your potential clients or to your clients. Okay. The consultants, Pivotal consultants. So the Pivotal consulting program will be headed by Esther and supported by the Pivotal team, designed to assist seniors and their families in navigating the private and public sector system in order to determine the best solutions available to meet their unique needs and goals. Basically answering their initial questions of what do we do and who can help. Now, Esther is going to talk a little bit more about the consultations when she gets to the website, but I think it's important that you as a retirement home connect with us to get some more information on how the Pivotal Consulting Program can actually assist you when you're working with potential clients inquiring about your home. Okay, because we can design a program there to actually help things along. Professional consultants come from the paramedical area of practice, such as social workers, OTs, physios, nurses, etc., with a background in working with seniors. We also deal with real estate. We also deal with executor advisors. We deal in getting other services involved with the family or the individuals as they need. So basically it comes back to, you know, what do they need and who can help them? We can gather all of that information for them. Okay? Consultants will be able to help seniors and families start a conversation about care planning, assist with retirement home search and transition, refer to resources to assist with financial planning, real estate needs, legal issues, etc. SeniorCareAccess.com will be the source of information all consultants use for resources and housing. The cost for consultants will be paid by the consumer based on their needs and assistance required. Just like your retirement home offering, not all potential clients will fit your offering, and not all potential clients will be able to meet the requirements of the Pivotal Consulting Program. However, for those that do meet, it's a fantastic tool for you to use, as well as a service for them to tap into. Consultants will also be trained to use and teach the Ashby Memory Method, which is the cognitive retention therapy program that Pivotal has licensing for. Okay, now you're all here for the Vacancy Program, so I'm going to touch on it right now. It is a new concept that does not exist on any other website. The Vacancy Program could be used or accessed in 3 ways, and this is a very simplified description of the 3 ways. Number 1, a retirement home or retirement homes indicate that it has a vacancy within our system. Professionals can then search for vacancies, inquire, and make a placement. Second, retirement homes can participate in our vacancy program with hospital discharge staff. Staff can then search availabilities and make a placement within the system. And number 3, the retirement housing solutions can have their rental or sales listed on the MLS system through our Pivotal Seniors Real Estate Program, offering search capabilities across Canada. Okay, and if you're interested in knowing more about that, I suggest you just reach out to us, and we can discuss that, of course. We will give homes the option of letting us know when they have a vacancy for all levels of care available. Homes will have the option of updating and entering their information on their own, so they have complete control of what members see. I'm going to repeat this for you. So the retirement homes, yourselves, will have the option of updating and entering your own information so that you have complete control of what others see about your home. Okay, so it's kind of important that you have access and you take us up on that access to update the information that we have about your home. And Esther will talk about how you get access on that, because we're going to give you a special code. It's just for you. You'll get into the system. Now, those who work with seniors and are members will have access to this information in real time and at no extra charge. So it ends up being a win-win. Those with vacancies can fill their beds quickly, and professionals who work with seniors will save time and effort when they're able to organize a quick placement, as well as being able to search many housing solutions. As homes start to see the benefits, we will include paid options for the homes to add their listings like photos and virtual tours. You are not required to pay for the listing that we have currently, but as we bring in other options, anything beyond that, there may be a fee for. Okay. And as this develops, we would like to bring the standard retirement home opportunity to the MLS system via the Pivotal Seniors Real Estate Program. So this is really just the beginning for us. Our vision is to continue to add resources and features to the site and developing an extensive network of information and support for our aging population across Canada. We will be the place people come to find out about all things about seniors. Okay. This is our contact info. We're going to bring this up a little later on. So I'm going to continue here with the actual vacancy program from hospital discharge to retirement home. And basically it's the bridging of the public sector with the private sector. So in developing the vacancy program, we had to look at who is involved, what is their view, and what are their goals. And as you will shortly see, the vacancy program aims to bridge the patient to a client. Now, I think this is really important that you take some time to focus on this next piece of the presentation. And we've put a fair bit of time and effort into this only because the issue that we see and we recognize is that we're taking a patient who is coming from the public system, and somehow they end up being a client in the private sector. And typically, whenever you hit private sector, you actually have to pay for services. So with this vacancy program, it's important that the retirement homes understand their role, what the hospitals are looking for, as well as what the client is looking for. And then reverse of that, it's important for the hospitals to recognize what the homes are looking for and what the patient to becoming a client is looking for. And basically, that's what this vacancy program is about. It's a way to bridge that opportunity. Will it work for everybody? Absolutely not. We already know that won't work for everybody. Will it work for a certain percentage of hospital discharges? Absolutely. Is it available right now? Yes. Some hospitals will go around and they will call certain retirement homes to ask. And if it works out, then that's great. But that's a lot of time and effort on the social worker at the hospital. So this program is really meant to give them a very easy to use tool to access your vacancies. Okay. So the viewpoints from both public and private sector and the public. The viewpoints are the public's, the hospital, and the retirement home. Now, long-term care is not an option at this time because it is solely controlled by the LHINs. And as we know, the LHINs are going to be going through a transition themselves. However, in other provinces, this is less of a factor due to the multi-level care solutions that they provide. Okay. So let's talk about who is involved in this whole process. So the three sections, again, are the public, hospitals, and retirement homes. So with the public, now these are individuals and families of those individuals that have sought medical assistance. At this point, they are patients at the hospital. They are relying on medical practices to treat or cure and rely on their opinion for what's best for them. However, once they are relieved from medical care, they are considered to have the power of choice, and therefore, if they choose additional services, they may become a customer or a client of yours. Of course, they are eager to go home, right? Esther, I'll just, I think you're making some background noise there. I'll just
Right.
ask you to be a little quiet there.
Yeah.
So who is involved regarding the hospital? So the hospital is publicly funded, viewed upon as the place to receive medical assistance, and is accepting of being the patient of a doctor, implying they are under the care of a doctor. Here, the individual is a patient and may rely heavily on the guidance of medical staff. I think we're all in agreement of that. Then we have the retirement homes. They are privately funded, viewed upon as a place to age. The property owner rents room and common space for a monthly fee with additional options of care. This person is now a customer or a client, is required to sign a lease, and the lease is governed by the Landlord and Tenancy Act. I think at this point it's quite clear that you can see the different viewpoint of a hospital with the patient and how the retirement home looks at that person coming into their home. The problem is the potential client, as they transition, they may not realize what their actual position is. And they may feel that, oh, if the hospital referred me to the home, OHIP is still covering it, or I'm still a patient of the doctor. And that's not necessarily the case, okay? So continuing, what is their view? So hospital or public sector, which is not for profit, public looking to recover or in many ways to improve their quality of life post-medical health procedures or care. Some simply need some temporary support in order to return home and resume their daily lives, while others may be in a position for a longer period of recovery or a lead-in to a more permanent option of housing plus care. These are the types of people that you will be targeting, okay? And I don't mean that in a negative way. I just mean that's who your potential client base is coming from. The participants served are considered patients. The hospital is guided by policy and procedures, as well as liability limitations, and therefore is challenged in offering solutions beyond the public sector services. Again, I think you would agree on the retirement home side that that's how it's viewed. The flip side is the retirement homes, which is a private sector, which is for profit, offering various levels of housing and care needs under one roof. Other than long-term care, retirement homes seek to fulfill vacant rooms via marketing to the public and older adults seeking a particular lifestyle. However, many homes have or offer the option of making available short-stay solutions for those seeking a temporary housing or care need. Because the retirement home industry offers housing on a rental basis, the industry falls under the Landlord and Tenancy Act. The participants served are customers and in some cases clients. The bridging occurs when the I need help family transitions from hospital care to retirement home housing. Without a structured bridging program, these two influencers struggle to have their goals fulfilled. I will say Esther and I are challenged at times by both sides, in that both sides really want to dictate what they want, and they're still not willing to listen to the other side. So we find ourselves in a position where we're trying to reiterate this information so that the program can actually flow. And then there's others that say, yeah, this is great. Let's sign up, let's do it, and let's get to it, okay? Now, the public often gets caught up in not understanding the difference of service providers, the public versus the private, is not aware and refuses to understand that private services may be the best option and will require payment. Because of lack of experience, they are unaware of available solutions or challenges faced after discharge. So what are the goals? Again, the three parties, They each have their own goal. So without going into the debate of identifying the number of vacancies a particular home or brand of home has, the Senior Care Access Vacancy Program offers to create a simple bridging of patient to client, enabling these two major influencers to be able to fulfill each of their goals while delivering a more direct, quick, and simple solution to the end user, the senior. The hospital goals are able to confidently offer outpatient housing and recovery care, while the retirement home is able to fulfill their vacancies and meet corporate goals. The retirement home is able to create and offer a select number of vacancies that would sufficiently provide temporary housing, plus care in most cases, effectively increasing their income. For some of these clients, a more permanent solution may be required, and the familiarity with the home, the care, the family, and the staff may make it so that they may continue their residency. For some brands, bonuses are offered based on fulfillment. So you can see that there's two very different goals between those two parties. And of course, the public's goal simply wants to get better and enjoy life, while the caregiver seeks ways to reduce their stress. So all three parties with three very different goals. The program is designed to help bridge all of that. So cost savings, this is always a question for the hospital. The ever-growing population will need medical care and hospitalization, effectively pushing current and future resources to the limit. Again, I think we're all in agreement with that. Current models see staff under pressure to deliver high-quality care while providing for a more rapidly availability of bed space. The hospital social worker teams are pressured with lengthy caseloads and liability restrictions, causing families and patients to ask, what next and who can help us? The LHINs are a strong resource, but I think we can all agree they are stretched to their limits, and the future model of the LHINs are in question. Hospitals are challenged with continuous needs of patients, providing enough beds for care, and the ever-rising costs of delivering care to those beds. These costs are both hard costs, soft costs, and manpower costs. It has been witnessed that patients may be returned home without sufficient care in place, only to return a few days later, effectively starting the entire process over and possibly seeing the patient in further decline or as having additional care needs as a result. Again, I think we've all witnessed that. If, by using the Senior Care Access Vacancy Program, hospitals are able to effectively, quickly, and supportively offer recovery housing and care solutions to patients, easily achieving a cost savings, not to mention the greatest goal of allowing the patient to return to their normal lives and remain outside of the hospital care. For the retirement home, the constant influx of potential short-term stays will never diminish. Therefore, if, say, 5 beds were to be made available for the vacancy program, could the hospitals provide candidates that are in need of the room and care, and are they willing to pay for it? We think, given the number of older adults needing this service and families unfamiliar with the options available, these vacancies should have little challenge in being fulfilled. These vacancies will offer a revolving supply of clients at no cost for advertising or additional manpower. Think about it, okay? And you don't have to offer 5 beds. All you need to do with this system is just indicate that you have a vacancy, okay? And then, of course, for the public, respite and short-term and even longer-term rental with care is potentially less expensive than hiring home care and covering housing costs, not to mention the cost of safety, security, and stress relief for the family. Huge benefits, okay? Then we come to, what do you want? Senior Care Access is the glue or the conduit, but it is important that both influencers understand the importance of their role and the needs of each other. And we are challenged in identifying and making sure that both parties understand this. We are offering this as a pilot program, but we already have great interest from others. We already have a second hospital on board for this pilot program. And once we're done the pilot program, we'll be rolling it out to other areas as well. So coming up with what do you want regarding the hospitals. They need a simple way to search what is available. Senior Care Access provides the database and search capabilities. They need a simple single form for referral. Senior Care Access has developed the referral form. They need to be confident in the person or location they are referring to. Remember, this is their patient at this point. They need to be able to refer more than one solution, and they need quick turnaround, or at the very least, quick acknowledgement of the referral. Now, what does a retirement home want? Well, if I was a retirement home, if I was an owner of a retirement home, I would want 0 vacancy rates, and I would want long-term clients. I would want qualified clients, because the patient's care needs fit the services I provide. Client understanding that services are private sector and will require payment, not OHIP, long-term care, or hospital. So I don't want a potential client coming to me under the assumption that it's free. So I would want them to already know that there is a fee involved. Reserve the right to conduct their own assessment, which you would be able to do. Feel confident that the hospital provides all known information, including cognitive impairments, behavioral concerns, and mental illness. These are 2 challenges. These are two groups or 2 organizations that are coming from 2 totally different viewpoints. If we don't understand each other, then you're not going to be able to benefit from the program. At some point, everybody needs to take a breath, maybe a step back, and say, this is a great way for the program to work. Let's see how we can make this work. Okay. So basically, we want your input. You're already involved and enrolled in the program. We are looking for your input in, do you see this working? Is there anything else you need to facilitate this program? That's a key question. Okay. Can you offer your comments or suggestions? Because we're happy to hear you. You're already in the program. And we're excited to be able to put this forward and to start piloting it. I think it's going to be a great opportunity for all 3 parties to be involved and to offer a better level of care for the public, for the senior. Okay. Now that we've explained the program and identified the players, we would like to walk you through the actual site, exposing you to the front end, the back end, and your specific home's access to data and the ease of this entire program. Okay, so with that, Esther, are you ready on your side?
I'm ready.
You are. I'm going to stop my share, and then you're going to jump in and you're going to share your screen.
Okay.
In the meantime, I can have a glass of water here.
Okay. I'd like it to share. Okay.
There we go.
Can you see it?
It's coming up, and there you go.
Okay. So this is our homepage. It was imperative to us that access to the site be simple and definitive. So it's being designed to offer navigation tabs along the top. However, there are really only 3 entry points into the site designed to meet the needs of any user as they navigate data, care, and resources for seniors. So I'm just going to scroll up so you can see the 3 points. So the first entry point is for professionals, researchers, discharge staff, consultants, as it relates to seniors housing. The second entry point is for both the public and professionals when seeking consulting services. And in this, there is navigation for families. The third entry point is for the public as well as for professionals in seeking services or professional networking. So I'm going to walk you through each section of the site. So the first entry point is for professionals. So the reason that we've done it this way is because most people in the general public do not know the difference between different levels of care. And so we really believe that the people that should be delivering the data are people who actually understand what it means and what choices are when it comes to types of care. That's why this is really geared towards the professional. And it includes the retirement home administrators, hospital discharge planners, any care service providers, senior service suppliers, placement organizations, consultants, even government agencies. Consumers can still use this site, but it's going to be a challenge unless they understand the different types of care. So that's why our primary focus is for professionals. So once the user becomes a member, they will have access to unbiased and comprehensive information on thousands of housing options and different care levels for seniors. All components that make up the data can be accessed through our search function. So I'm going to show you what I mean by actually logging in and showing you our starting page for members. So you have the ability to search in two ways. The first way is a very quick search. You can just put in a home name and the home will come up. The other is a much more advanced search. So if we start by just putting in the province, then a city, so we're going to look at Toronto. We have all the cities in here that have homes listed. And something like Toronto is actually divided into 4 sub-cities, simply because Toronto is so large that we want to have a way for you to further reduce the number of homes to search to make it a bit easier. It'll narrow down your search. So if we go to Toronto, North York, what you'll see is there's the opportunity to see every single home in Toronto, North York, or you can just leave it at Toronto, North York, and everything will come up. Also, if you know just the name of a street that a home is on, you can search by a street name and the homes on that street will come up. The next option you have is to search by types of care. And this is where the vacancy program comes in. First of all, you have a multitude of choices. And right now, what we have online is retirement, assisted living, some short stays, long-term care is listed. The independent housing features will be coming on board as the year progresses. Mm-hmm. So if we want to search for a retirement home, it gives us the option of searching with vacancy. If you click with vacancy, what will happen is only the homes in that area that identifies a retirement home that have a vacancy will show up on your list. However, if you want to just search by the homes in that area, you can just search by retirement home. You can also include other things like, is it government subsidized? If there's a specific owner or manager you're interested in. If you need a home that offers 2-person transfers, or has a secure unit, or has indoor smoking. Very few homes actually have that, but there are some with indoor smoking rooms. Things like medication management, extra care, personal care, continence care, all of these things are things you can actually search by. Culture, language, specific meals, price range, or just a certain postal code area. So just for the purpose of you actually seeing what a listing looks like, we're going to search for homes, for retirement homes in North York. What you'll see is there's 15 of them. So you can select any of those homes and you will see a full display of their information. So let's just search Terrace Gardens so what happens is it rolls down and you will see the kind of information that we have. So what we have here is contact information right at the top. Now, one thing that will be linked here very shortly is the option of using our generic referral form, which you have that option of using, or you can contact the home directly for their referral form. You can see different kinds of care they have, and here they've actually put where they have a vacancy, which is all part of our vacancy program. So actually, you'll see the application form's already been linked under the kind of care. The at a glance section basically gives you very quick information that you may need just to have a very quick overview of what you need to know. The type of care is listed. So here they have independent living. They're telling us their costs. They're telling us that they have how many they have, that they have handicapped suites available. They have 12 assisted care units. They do accept people for memory care, but only ones that are not wandering. They've given us building information, what they're close to, languages, different menus, building amenities, staff services, suite amenities, and that they have pets. Pets are allowed. Now, keep in mind here that any home that is licensed by the RHRA also is on their register, where you would be able to see if they have any issues with the licensing. So we have a link there that's a live link that'll take you straight to the RHRA register. All you'd have to do is plug in the name of the home, and you can actually pull up any inspection reports there. So that's how the search works. And I just want to see if there's anything else. Okay, so the other things I need to tell you are, you can also favorite a home. Mm-hmm. So say you like what you've seen in Terrace Gardens, all you'd have to do is click a heart, and now it's saved to your favorites list. And the next time you log in, or at a later time in this login, you can click on your member home, and it's going to ask you about your favorites, and you can pull up your favorites right there. The other thing that our users are able to do is to create their own notes. So if there's something specific you want to remember about Terrace Gardens, you can create a note that will then be saved to your account only. So the next time you go in to Terrace Gardens, you can look up your notes and see what you wrote about the home. No one else will have access to your note but you. So that's kind of a nice feature. I wouldn't put anything confidential about a client or a patient, but what you can put there are specifics that you want to remember. For example, if you spoke to the person and the person said, we take pets, but there are some specifications around it, and they told you what these specifications are, you can put it in there so that if you have a client that wants to bring their pet with them, you know right off the bat what those issues are. So I think that explains everything about the search box. I can then go on and show you our second entry point, which is our consulting entry point. So for professionals who may need help with clients or consumers or their families, we have a consulting program. As Paul mentioned, the Pivotal Consulting Program is meant to assist seniors and their families in discovering what solutions are available and targeting their needs and goals. Pivotal consultants offer a starting point in answering what do we do and who can help us. The program starts with a 1-hour consultation that's free, and that would be our intake, and that's how we get required information. A goal or need requirement will be discovered, and an action plan will be drawn up. The action plan is presented, as well as the cost to implement the action plan. Should the client accept, a contract is drawn up, and we begin the process. The process may be simple, requiring a few hours of work, or it may be more extensive, covering several months, and the input of third-party professionals. Regardless of the depth of involvement, the client controls the process. In order to offer a pivotal referral, all you would do is complete the referral form and forward it to us. So if you see in blue on your screen, it says referral forms here, you would just click that, and it's a very quick one-page form that ensures that the client is aware of the referral and gives us permission to contact them. Now, if you're a hospital social worker, you may need our services if you have a client that's being discharged and is stuck and doesn't know what to do once they go home, and they may need extra services, they may need lawyers, they may need accountants, they may need more complex care at home beyond what home care can provide, and they just want to know, who can we contact if we run into problems? You're welcome to give them our information where they can make their own referral or send us a referral so that we could get involved once they're discharged. Our third entry point is for both seniors and professionals who need information on senior-specific resources. So this is our Senior Resource Partner section. So seniorcareaccess.com is building a network of service providers whose services are focused in working with seniors. The service partner search begins by, here again, choosing a province. So everything's set up exactly the same way through the site. Then choosing a city, and we're going to choose Toronto when it comes up. Here's Toronto. Okay, and here you will see the different kinds of categories of services that we have. So I'm going to just select one of them so you can get an idea. So we have a maximum of 4 resources for any category. There is a cost for the resources to be part of this, but there is no cost for users to access it. So this part of the site is free to all users. So those that are the featured resources actually pay to be part of the database. And the reason is because it is giving them a very focused client base, and it gives our clients that come to the site only 4, so they're not getting confused by huge lists of things. Each listing has within it a banner ad, a description, contact links, and a link to the website of the company that's listed. So by just clicking the banner or the wording underneath the banner, you would be taken to a website. The resource section of the site also offers a database of articles. And so we have all sorts of articles here in different categories that is also free for all of our users to access. We also have an online store for different kinds of publications that may be useful to consumers and families coming to the site. So currently we have information on visiting tips, we have developed a care planning workbook, and we have information on the different care options for seniors in Ontario. So that's our site in a nutshell.
All right. So that's awesome, Esther. Thank you. So really, this presentation was designed for both the hospital, social worker and discharge, as well as information for the retirement home sector. So you'll need to decipher or pull certain parts of this presentation as it relates to how you're coming to the vacancy program. We would love your input, your comments. We're here to make it work. That's basically our point here. And if there's something that you see could be improved, something that maybe is required, we're open to having that conversation. And as we continue to develop areas, territories, or cities, we would then start to build on those additional resources for those areas. Toronto, obviously, being one of the largest, actually the largest city, right, of Canada, and we're all here, Golden Horseshoe out to Ottawa area. So we're trying to gather this information and to build on this. However, the database that we currently have is across Canada. So the homes that Esther was indicating that you can do research on is already there. And I will make another note that for hospital discharge or social workers at the hospital point, looking for potential respite outside of their jurisdiction or outside of their current city, they still have access to other cities with retirement homes. So for example, if you're in Toronto, your client has come to you in Toronto, but they actually live in Kitchener, and that's where they're going to go back to, you can actually assist by doing a quick search or an elaborate search to look for what's available in Kitchener. Okay, so it's not just for your direct vicinity. Now, the vacancy program, however, that we're piloting is for the Toronto area right now. But as we develop and implement it, we'll be reaching out to all hospitals and cities across Canada. Okay. Esther, is there anything else?
Nope.
Nope, you're good?
Yeah.
Okay, I think we've said enough for now. Thank you very much for listening in. And you should all know how to get a hold of us because you would have received this information or communication from us. I can be reached directly at 905-399-7285. Esther can be reached. Which email would you prefer there, Esther?
Esther at Senioropolis, or you can actually go onto the site and click the contact button, and you can reach us that way too. My phone number is 416-457-6554 or 905-482-0124.
Awesome. Okay, so that wraps this up. If you have any questions or concerns, by all means, email us. And like I said before, we'd love to hear from you. Okay, hope you have a great day. Thanks for listening.